Good evening, everybody. Hi. So, welcome to the virtual postgraduate info week. We are the business administration in healthcare management. So, we will be giving our talk on what we are. Just a few seconds about housekeeping rules. So, we have muted the microphone of our attendees. All your questions and feedback will be used and placed in the Q&A panel. Okay? And then this webinar is recorded. Okay. So I will introduce the speakers. Next slide. So the speakers tonight will be Dr. Vijay, our program director. Okay. So he has been the one that's conducting. Will be giving a talk first later, and then there will also be Dr. Nandini. She is a medical doctor. She is a student currently, along with Dr. Jonathan Chua, which is also currently a medical doctor and a student, as well as Adam Hapley, which is also our student and a chief operating office right now. Also, we're gonna let top one, Safura, be talking to us, and she is the pioneer of this whole course. And without further ado, I will hand over this whole talk to Dr. Vijay.
Okay, good evening, everyone. I'm Dr. Vijay, the Program Director for Business Administration in Healthcare Management. In short, we call this program as an MBAHM. Okay, first of all, welcome, and thank you for the time that you guys given for us to explain on our program. Okay, all right. First of all, why we are offering this MBA Healthcare Management program? The aim is to equip managers with relevant skills for leading and managing various aspects and challenges that confront professional managers and those keen to manage the healthcare industry. So basically, we are focusing on the healthcare industry, and we are providing a program that can enhance and equip the current hospital doctors with the management skills. Right, so what we are going to do is that this particular program will give learners a firm understanding to critically assess the health system and healthcare structure and apply core principle of management in healthcare setting. Right, basically we are again emphasizing here, focusing on healthcare setting and healthcare industry. But we are giving the important or the crucial information on the management side. Graduate will benefit by building their personal and professional competency and glean insight into best practices and formulation of effective managerial and leadership strategies. So these are some of points or key points why this program was developed and why this program is offered to this healthcare industry targeted group. Right, so how this program works. 3 IMA Business in Healthcare Management programs are offered. We have 3 levels. The first level we call Postgraduate Certificate of Business in Healthcare Management program. The second level we call it as a Postgraduate Diploma of Business in Healthcare Management program. And the highest level we call that as a Masters of Business in Healthcare Management program. Okay, so we have 3 levels: PGC, which is Postgraduate Certificate, PGD, which is Postgraduate Diploma, and MBA, which is Masters of Business in Healthcare Management. Right, how it works. So this is to show to the participants that we have what we call a multiple entry and multiple exit. Okay, what does it mean? Yeah. Let's say you registered for PG cert. Okay, PG cert. To complete this PG cert, this part, yeah, PG cert will take 6 months of courses, and you may exit after completing this particular PG certificate in business Administration Healthcare Management. You complete PGC, you can exit, all right? Or you can continue to the PGD program, which is we have 10-month course, 6 plus another 4 months to complete your PGD, and you can exit. All right, once you exit, let's say you felt that you're not ready for MBA, you can wait for 1 year or 2 years and come back to us to complete the MBA program. And this is another 5 months, extra 5 months to complete your MBA program. So this is to make sure that we have a levels that you can come in, complete a certain level, exit, and come back later to complete another level. Those who felt that we need some gap or time between one program to another program. Or you can register for MBA program and you can run through the entire process within 15 months. So this is why we have here, we call a multiple entry and multiple exit. You can enter in PGC, complete, and you can exit. Or you can enter in PGC, and you can continue later until MBA program, right? So these are the duration, yeah? 6 months, 10, and 15, according to their degree level. Right, why participants need to look into this particular program? Okay, number one, these are the key points. Yeah? Healthcare lacks well-trained leaders and policymakers. And this particular program will help us to understand, will teach the students to understand more in depth on the management side and how we can use that on the healthcare setting. It's fully utilized without compromising your weekdays. The classes are conducted on Saturdays and Sundays only. So you have your weekdays with you. Only the weekends will be occupied with the classes, Saturdays and Sundays, depending on the mode, whether you are going to do as a full-time or part-time. Okay, and this MBA program is going to be additional qualification for your future career advancement. Apart from that, it will develop your management skill as well as your soft skill. Okay, it will help you to learn the healthcare system works and envision policies. We have various influential guest lectures as well as industrial visits. And also we have industrial opportunity with an opportunity to connect with various corporate leaders and also to connect your classmates who might be healthcare leaders in the future. I'm going to say it's not in the future. We have students who are leading, holding a bigger post on their in their respective hospitals. Yeah, like today, Adam, he's a CEO of pathology department. Like Dr. Jonathan is heading a quality department in Hospital Sungai Buloh, and so on and so forth. So we have some leaders who are doing MBA program for their future career advancement. So how are you going to do this program and what are the criteria need to be fulfilled? So the applicant should have a bachelor degree with a minimum of CGPA 2.5. That's the base. Assuming if you have below 2.5, can you do the program? Yes, you can, if you have at least 5 years of working experience. Right, so we open up in two ways. One, those who are having 2.5 and above CGPA in bachelor degree. And for those who don't have or never achieved 2.5, you can still apply. We can use your working experience as a platform for entry this particular program. Right, this is just to show our lectures. This is on the first cohort. Yeah, this is our first cohort student. The lectures are conducted in hybrid mode. Okay, hybrid mode means the classes are conducted physically in IMU, and also the classes will be virtually online. Students who can't make it to the class physically, they can attend the class online or virtually in real time. Okay, this is to make sure it's flexible for adult learners to be physical as well as in online to learn our program without failure. Okay, this is before pandemic. Yeah, now because of pandemic, we are using 100% online. Hopefully, if everything goes well, we will be back to normal procedures, which is the hybrid mode, physical class with additional virtual online classes for those who can't attend physically. To make things more clearer, we have students from Dubai, we have students from Kedah, we have students from Penang who are doing this program virtually in real time. Right, this is some picture of industrial visit. The guest lecture will be called in. The classes are more interactive. It's not just based on notes or lectures. It also more on experience sharing by industrial leaders. And also we do industrial visit to related to the subject matters. Okay, again, the industrial visit depends on the pandemic era. Yeah, before the pandemic, we managed to visit ample of places for the students to gain experience towards their subject matters. Right, the most important question, the fees, how much the fees will be. So here you can see that the MBA program for local will consist of, this is just a tuition fee, yeah? This is tuition fee of 40,000. And for international student going to consist of 44,000. Okay, so with that, I'll end up my session. If there are any questions related to this program, you can put it on the Q&A session chat box. I will address that. So now I'll pass it to the second speaker, Dr. Nandini.
Hi, good evening, everyone. Hi. Okay, I'm sure you guys can see me. Let me just share my screen so you guys can see my slides. Yeah. Oops. You're not supposed to see this. Okay. All right. So good evening, everyone. I'm Nandani Kumarasamy. Fun fact, I'm a student here at IMU. I am currently doing the MBA program. I am also an IMU alumni. I graduated from the medical program about 2 years ago. And this is my 7th year as a student at IMU. Yeah. So if any of you guys have any questions about the student experience here in IMU, I'd be more than happy to answer them. Okay. So what I'm going to do for the next few minutes is I'm going to share with you why I chose to do this program, the MBA in Healthcare Management here at IMU, and also how this relates to my time. Yeah. Okay. So I'm just going to jump right into it. So why did I choose to do this MBA in healthcare management? Yeah. So the healthcare industry right now, we are undergoing a lot of change and we are on the brink of going into a new era. Yeah. And why are we going into this new era is that populations all over the world are changing. Okay. They are growing and they're aging, and more chronic conditions are becoming more common. Yeah, and because of this, you will need a lot more health professionals, and more people are going into the industry. And because of Industry Revolution 4.0, we are also looking at a boom of technology, specifically healthcare technology. Yeah, okay. And as we go into this new age, the healthcare organizations that will be the most successful, they will have leaders with a few of these distinct qualities. They will have leaders that are very focused on the future. They are able to capture trends before they become trends. Yeah. And it's not only important to capture these trends, but it's also important that these leaders integrate them into their organization. Okay. And they have to do all of this while ensuring quality of patient care is not compromised, that quality of care is still ensured and it is still the best that they can offer. Yeah. So as we go into this new age, this new era of healthcare workers and administrators will work together towards these changes, towards capturing these trends. Now, the problem is these two groups don't speak the same language. Yeah, there is a gap in communication. Administrators speak in terms of facts and figures, whereas healthcare workers, healthcare professionals speak in terms of the patient's point of view and patient's expectations. So there is a gap in communication, and unfortunately, it is a wide gap. Yeah. So why I decided to do this course is because as a medical graduate, as a medical doctor with an MBA, I will be able to speak a language that bridges this gap. I'll be filling a niche in the industry. And through this program, I would be gaining a range of skills that include shaping resilient policies and and using systems thinking in coming up with these policies, and also developing leadership skills as well as networking skills. And these are just among the few skills that I can think of that you will be developing, you know. And so this is why a medical graduate with an MBA will be able to capture trends and go into this new era with skills that will make them a meaningful addition to whatever organizations that they work in. Okay, so next one. So why did I choose to do this MBA in healthcare management in IMU? Okay, so very simply, it's because IMU is a market leader in the healthcare industry. It's a fact, yeah. And what was offered was networking opportunities with industry experts. And that was what I received in this course, and I'm quite happy with that. Yeah. And also, as an IMU alumni, as I mentioned, I graduated from the medical program, and I was able to see and I was able to gauge the quality of education um, given by IMU, offered by IMU, and I see that they're very reliable and trustworthy. And that was why I was very confident and very comfortable with making this decision to rejoin IMU in this journey. Okay. So next, so why did I choose to do this now? So I am a medical graduate. I just graduated 2 years ago. So the short answer is time. Yeah, I'm in a very special place in my life right now, where I'm right after graduation. I don't have any familial or any adult obligations. So in very simple terms, I'm very free, you know. So if you're like me, you will be able to take up this course full time, which was what I did. I took up this course full time. And it was my only commitment for 15 months. And that will be the case for you, might be the case for you as well, whereby classes will only be during the weekends. Yeah. And I chose to do this now because I felt that as I moved into my clinical career, a lot of other obligations would come in. And there would be challenges like uncertain job schedules, there'll be swapping of schedules. Soon there'll be a family, there'll be kids, there's spouse. And honestly, that I felt would give me very little time to pursue further education. It's tough, it gets tougher, but it's not impossible, as proven by my colleagues in this course, obviously. So, but for me, I felt that this was the best time for me, you know. And so, how did I utilize this time? So, as I took on this course, I did it full time, and it was my only solid commitment for 15 months. And classes were only on the weekends. So, weekdays were essentially free for me to pursue whatever I wanted. I got a job, I could pursue hobbies, I could take on new classes, and I did internships, So, weekdays are essentially free. But I also spent hours during the weekdays in completing assignments and coursework. But yeah, that's normal. I would say this course was not breezy, but I will tell you, it's definitely not for the weak-minded. I did spend hours on my weekdays completing assignments. And after going through this program for about 12 to 14 months now, I felt that it was worth it because the hours put into my assignment actually changed the way I thought, and it made me see healthcare from a very different perspective. Right now, I'm seeing it from a bird's eye perspective. And so, yeah, that's why I felt that it was worth it. And to be honest, the key to getting through this program is compartmentalizing. You have to compartmentalize what you're supposed to do and prioritize. And the plus point with this course is that the faculty has been extremely understanding and very supportive. So I felt like I was not alone doing this program. And they were very, very helpful with getting through a lot of challenges that I had and whatnot. So in the end, I felt it was a good decision. And that is why I chose to do the MBA in Healthcare Management in IMU. So yes, that is the end. So if you guys have any questions, Please feel free to put your questions down in the text box and we will get to them. That's it. Thank you.
Right. Thank you, Dr. Nandini. Now, Dr. Jonathan.
Hello, good evening. Can you hear me?
Yes, Dr. Jonathan.
Okay, hi. So good evening, everyone. My name is Dr. Jonathan Chwazian. I'm an alumnus from the IMU PMS program. I'm actually from batch ME 210, and I graduated with an MBBS from UNSW in 2017. So currently, I'm a medical officer. I'm working in Hospital Sungai Buloh in the quality management department, but I'm also seconded to the bed management unit currently in view of the COVID-19 pandemic. I decided to pursue the MBA in healthcare management in my alma mater last year. So as you can see, my introduction, I'm also a JPA scholar, and I did my housemanship in HUKM, and I was floating MO in HUKM before being sent to Hospital Sungai Buloh because of the COVID-19 pandemic. Okay, so I've been asked to speak about as a doctor, how will the MBA in healthcare management strengthen my competence? So as doctors, we are always taught to utilize the principles of evidence-based medicine in treating our patients. This can be summed up as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. We aim to be the best, to give the best. However, when we assume leadership roles in the hospital, our scope goes beyond individual patients. We must treat the very system itself, giving it the medication and the surgery that it needs to recover when it is ill, preventing the system from falling ill and spurring the system to improve for optimal health. By taking the MBA in healthcare management, we as doctors will learn to practice evidence-based management of the medical system. The knowledge gained will help us to think more critically about our work. What are we doing? Why are we doing this? And how can this be improved? So I would like to relate some practical experiences that I've had. I was involved with the MSQH auditing process of hospital departments last year. And just last week, I attended the ISO 9001-2015 course organized by Jabatan Kesihatan Negeri Selangor. In the MBA, we will learn why exactly such quality assurance and improvement measures are important and how this applies to our individual healthcare institutions and service rendered to our patients. As mentioned earlier, I'm currently in the BMU of Hospital Sungai Buloh receiving new patients to our hospital. We really struggled in the initial phases of the third wave, especially in the process of streamlining our admission process. In the end, it was through using lean principles that we managed to ensure a smoother referral and admission process. Lastly, what is the experience of taking an MBA if one does not build professional networks? I'm profoundly grateful for the new friends made and that I'm continuing to make throughout this MBA journey. As someone who is relatively new to the healthcare management field, I'm always comforted and reassured by my colleagues and lecturers who are always ready to mentor and impart their wisdom and experience to me. So in closing, I would love to extend my heartfelt appreciation to my lecturers and colleagues. And to you, my dear listeners, I hope my testimony helps in your discernment in your healthcare management journey. I look forward to meeting all of you one day. Thank you. And I can be contacted at this number. Here's my email and my LinkedIn as well. Thank you very much.
Right. Thank you, Dr. Jonathan. Thank you for the sharing. Next, we will call upon Adam. Adam, you ready?
Yes, Dr. Vijay. Let me share my slides.
And we want to see your face as well.
Sure. Okay. All right. You guys can see my slide, right? Good evening, everyone. Thank you for coming to our presentation today. I know it's a Saturday night, but we are glad that we can share some of our experience, some of our learning curves joining the program. So as what Dr. Vijay mentioned earlier, I was part of the second cohort together with Nandini and Jonathan. My batch was last year, I think 119. So we joined in 2020 during the pandemic. So I was given the task to share with you guys how MBA HM has helped me in my career progress. So I really cannot explain it well without telling you guys the history of my career. So I started working way back in 2004. So you guys can roughly gauge already how old I am. So basically I'm 38 years old this year. I started my career way back in KPJ Hospital at the mere age of 23 or 24, I guess, that time. So I was freshly graduated. Then I joined Pantai Hospital Group as the lab manager in 2011. And that time, I was still part of the middle management. So after a few years in Pantai Hospital Group, in the Pantai Premier Pathology with the lab services, I decided to somehow pursue a master. But the decision to pursue a master is not entirely up to my own decision. It was more in terms of my career progression, because if you are very familiar with the corporate organizations, with the multinational company, one of the requirements for you to climb the ladder into top management is for you to have at least an MBA or master. So after looking around and searching for the most suitable master management to do, I decided to go specific for healthcare management, because I'm very much interested into healthcare, and I think MBA HM will be very specific into what I'm going to do, what I'm going to be exposed with in terms of my day-to-day jobs. So basically, as what explained by Nandini and Jonathan just now, I'm not going to touch again the decision, the reason why I joined MBA HM. But the gist of it is that when I took this program, I really can see in terms of multiple ways that it can really help me in my day-to-day jobs. One of it is definitely a better career opportunities and progression or shift in my work. So by having this under my repertoire, for example, it opened up more doors to me. I'm more exposed in terms of the possibility of climbing up the ladder into going to top management rather than just stay in the middle management. Apart from that, it also enhances your knowledge and skill. You might think that being exposed in the management for more than 10 years, you might have all the knowledge, but trust me, you don't. I have the same perception before I joined MBA. So after I joined, then I realized there's a lot of things that you can learn and that you can be exposed to from your lecturers, so from university, even from your colleagues, even from the networking that you did during the program. So I really learned a lot into our management skills, into our leaderships, into how you want to handle finances. So in terms of knowledge, you really can gain a lot by going into this MBA HM. Apart from that, it's also personal development. So rather than just looking into a career progression, but it's also for your own personal development. By taking this MBA HM, you are not only looking in terms of progressing in your career, but it's also part of your personal development in terms of having something that you can be proud of, something that can somehow increase your credibility, for example. Apart from that, I think it's most important to us is salary-wise. Definitely, once you have this MBA, you have a master, for example, in particular master in healthcare, your salary will be much higher, even higher than those having a regular master or bachelor degree. So definitely by having a master degree, master in MBA, for example, averagely your salary can be increased up to 20 to 30%. That's will be very much dependent into the organizations, but average will be around 20 to 30% in the salary. So I think most of us will look into that as well as part of the reason why you want to join MBA. And the next thing that you can also find useful when you join the program is that in terms of networking. Joining the program last year, I think we are exposed to a lot of people, a lot of high management, a lot of CEOs from the companies. We are even exposed to, we even went to CPRC, for example. So it's something that I cannot think of that if I did not join this program, I will not ever have the opportunity to see CPRC, the one that really handle this COVID-19 pandemic. So by joining this program, specifically the healthcare management, we are exposed to all these relevant parties in the healthcare management per se, in terms of the MOH, in terms of the other private hospital. So it really helps us in terms of increasing our networking, meeting new people, even meeting new lecturers, new colleagues, for example. And the last thing, I think, how it helps my career progress in my current work progress is that the credibility that you are getting from having a master in healthcare, having a master in particular. By having this master, for example, it really opens up opportunity that other people can see you as something with a credible. It opens you up to people calling you for being a key opinion leader, giving you opportunity to be a speaker, for example, or even be a advisor or any other something related to your current work. So definitely, I really encourage you guys, if you think that management is your passions, I really encourage you guys to consider going for MBA. In particular, if you are very passionate about healthcare, I would like to encourage you to go specifically for healthcare management. Look into the university, the credibility of the university, the lecturers, and the alumni, because it's really going to define how good's your experience going for the MBA. So I'm glad that I joined MBA in IMU because, to be honest, before I joined, I was not even the COO yet. So I have to be thankful to MBA in IMU, because one of the reasons why I got promoted is because of the MBA HM that I took in IMU. So I think with that, I end my sharing session. So please, if you have any questions, you can always ask in the Q&A sessions, or if you want to contact me personally, you can maybe get my email letter towards the end of the program. Thank you so much, everyone.
All right, thank you, Adam. Thank you for the wonderful sharing inside of MBA program, and congratulations on your promotion. Yeah.
Thank you.
Okay, so now we are coming to the last speaker, Professor Dr. Tok Wan Safura. Tok Wan, yeah.
Yes. Thank you very much. Can you hear me?
Yes, Tok Wan.
Yes, okay. I'm trying to share my screen. Right. Is it on? Is the screen on?
Yes.
Okay. It's not, is this, I can check whether the screen is on or not.
It is, it is.
It is?
It
Is it on a slideshow?
Yep.
All right, great. Okay, good evening, everyone. Thank you so much for coming and joining us in this webinar to know more about MBA in healthcare management. And well, I have, I'm going to talk to you why MBA and not why MBHM, or would you prefer MBHM against MBA, and perhaps some sharing on it. Now, I graduated, I think with several qualifications here, you could imagine my age, but I'll just share with you that I started off with the Masters of Business, Masters in Medicine, a Bachelor in Medicine, and then Master in Public Health, and then I had my MBA actually in Boston. But when I was in Boston and I was doing MBA in the 1990s, I think I'm among the 1 or 2 doctors who took up MBA. All right, but when I was there, I had the opportunity of doing MBA in healthcare management concentration. They didn't have MBHM then, and they had MBA and concentration in healthcare. So that was a wonderful opportunity for me, and I learned a lot. And ever since I came back, I was made a deputy director, and then I was given the directorship in healthcare in one of the division in the Ministry of Health. Now, you've heard from your colleagues just now about how they manage and why they chose the program. And let me just share with you to substantiate some of the data or some of the big picture, what is happening in this healthcare industry. Firstly, it is the largest and fastest growing industries in the world, why industries, you know, in healthcare is such a complex industry. It has not only the clinical component, which is expensive and very human resource intensive, but it has a lot to that comes with it. You know, the pharmacology, the pathology, and many more. So it is a very large, complex industry, and altogether creating an accumulation of huge knowledge being generated every day. And today, healthcare takes more than 10% of the GDP of most developed countries. And in fact, in USA, it's almost close to 20%. Now, you just want to imagine what does 10% of GDP is. It means that, let's say, we have about maybe hundreds of sectors, be it agriculture, be it digital, be it education. Healthcare alone, out of that 100, it already sums out like 10% of the GDP in any developed countries. And of course, in the developed countries, probably it's much less because it is not matured yet. So you can see that if you can imagine the immense development and wealth that is going into the healthcare industry, it also needs manpower to manage it, okay? And just to show also that the global healthcare spending is already almost 10 trillion by 2022. And a company, all right, which is McKesson Corporation, it's an American company, it alone has revenues of 231 billion in 2020. So can you imagine? And this is not going, and these are what you call this sort of companies are spearheading many of the other medical industry which are following suit. In terms of employment for healthcare managers, it is projected to grow 32%, one of the highest. And I should have shared with you the link, but if you Google, it is among the highest. You know, every other industry probably have like 10, 20% increase, but for medical health managers, it's expected like 32% from the for over the next 10 years. So, you know, most industry will actually be craving for managers. But a lot of what is happening is that we have a lot of managers who's going to take on those positions, unfortunately, without the relevant qualification. So it is important that you know that the demand will be there, but perhaps equip oneself if you want to join the lineup in the journey, in the ladder towards in the healthcare industry. So, and not only the managers, of course, with 5 million new jobs, there's a lot of human resource that will be participating in this organization or in the industry. So why is the increasing need of healthcare managers? Number one, very basic, population growth is increasing. We have a lot of baby boomers and aging population, and I am among those baby boomers, and I'm among those aging population who needs lots of care, and many of them are having chronic care. And I think you've heard from Nandini and your colleagues just now, they are very aware of this situation, and they know that with this sort of situation and issues in front, and increasing medical advances, I think the healthcare industry need competent leaders. So what does Master of Business Admin and MBA and any general MBA, wherever you looked at one, it does, what does it do? Of course, it gives competitive advantage. If you have one, it gives solid foundation to knowledge. It provides you with the essential skills, and it gives you that leadership and people management. And you can hear what Adam was sharing just now, and I think you could internalize how he felt in the importance of going through and what you call enjoying the program, as well as hopefully getting the qualification, and how Jonathan has described how he could fit in the public sector hospital. So my last slide here, why MBHM and not MBA? Now, if you are in the healthcare industry and you want to pursue yourself and take up a higher position in healthcare industry, I think it's only apt that you take an MBHM program. And in IMU, what we do is that our MBHM covers all the basic courses which MBA covers. So all the general MBA courses it's being covered the MBH. But what is different is all the theories and the course that is given is interlaced with both non-healthcare and healthcare examples. We brought in guest lecturers, as you have heard just now, with very significant and healthcare experiences, that it is something that they can share with you. We also, during the classes and discussion, focus on in-depth issues of the healthcare industry now, providing solution. And what's more important is that because IMU is a medical healthcare institution to start with, we have many experience and capacity, and we have contemporary issues to discuss with you in healthcare. So I hope you will enjoy. I will hope it gives you a bird's eye view of why MBHM for you if you're in the healthcare industry. With that, now I pass back to Dr. Vijay.
Right, thank you, Dr. Puan. Right, thank you for the insight of the program. Why MBA, then why not MBA? Sorry, why MBHM, not MBA? All right, thank you for the summary. All right, now we come to the end of the session. For the program. So to summarize, what the program going to offer is that the program is to develop, basically focus on healthcare industry with the management principles. So we're going to give, as what Tok Puan said, we are going to educate with the management skill, but interrelate to the healthcare management. So it's going to be very unique, very interesting, and going to be challenged a bit. And challenges in understanding both the concept of management and healthcare, but it's interesting. It's interesting to learn two broader view to come into together and give an impact with the healthcare industry. So with that, we open up a Q&A session. If there are any Q&A session, if there are any questions you may throw to us, we are ready to answer. Is there any questions? It's now 8:42. We have another 3 minutes. If there are any questions, please, you can ask us. We are here to answer all the questions.
Maybe Dr. Vijay can also share the response you have shared with the question, the earlier sessions, the earlier questions, please.
Sure. Okay, there was a question on what if I do not have a degree and want to join the MBA program, right? So there's a pathway we call Apple MQA, which is you need to sit for the exam. And also that particular exam will tell us where you stand and what program you can do. So those don't have a degree, you have working experience with a diploma, you may try to do on the Apple. So if you have any doubts on that, you can come back to us. We will can guide on how and what to do on the Apple process. Yeah. The second question say any scholarship available. Unfortunately, for now, only offered for the IMU alumni students. There are no external scholarship available. Not available now. Currently, we don't have anything yet. But if you are IMU student, yes, you're given 15% of bursary discount. Right, the next question, I'm working full-time. May I ask the students how they manage to cope with the work and studies? Right, Benjamin? Sorry, Jonathan?
Yes. Well, it's hard. It's hard, but it's doable. You have to really prioritize your time and manage it well. You know, make sure that you also make sure to take care of yourself first. And also one thing I must say, our lecturers are all very understanding. I don't think I've asked for any extension yet, but well, Dr. Vijay knows that I'm still stuck with my research project, with the paperwork of that, and Dr. Vijay and Dr. Akil, who's my supervisor, they've all been very patient with me. So and our lecturers also understand that we are full-time working adults. So it's actually quite doable. I believe in the questions, Nandini, there's a question for you here. Why do people do the MBA after MBBS? Well, if you allow me to say a few words first, after the MBBS, you still have to wait. You still have to wait for what is it now? I think it's a year or so, or maybe slightly less. So I think doing the MBA, what Nandini has done doing the MBA in that time waiting for the MBBS is actually a very very good option. But Nandini, would you like to expand further on that?
Hi, yes, okay, hold on. Let me just turn on my camera. Okay, so that's a very good question. Very interesting. Okay, so the reason why I chose to do this MBA right after my after the MBBS, well, it's actually because I want to progress in my career, in my clinical career. I want to take up more leadership roles, and just climb up the ladder, so to speak. But the other thing is, I realized when I joined this MBA, I realized that it was also going to open a lot of doors for me in this industry. So I will not be limited to just the clinical side of healthcare. So if I wanted, I could still go into a healthcare technology company or a pharmaceutical company. So that basically gives me a lot of options that I can explore later on. And I think having options is very important. So yeah, I think probably that's why a lot of, or maybe people would want to join or do an MBA after the MBBS. That's what I feel. Yeah. Oh, probably one more thing. I know that in the clinical sector, you would probably progress and become a leader and whatnot, but you would be pushed into that role, and you would have to learn through experience, and you would have to undergo a lot of hard knocks in your experiences and whatnot. And with an MBA, you would probably know certain tricks and tips that you can apply, and you would be a better leader towards your colleagues and your team, and you'd be able to lead a good team as a clinician. So I feel like that's probably a good reason to do an MBA after the MBBS as well. So yeah, that's just what I think.
Okay, thank you, Nandini.
Thank you.
All right. Then the next question: what do the students enjoy most about the program? Adam?
Okay. I think what makes really is enjoyable with MBA is, I think, is meeting new people. It depends on you actually. If you are the extrovert type, then maybe you like meeting people. But if you are the introvert, maybe you enjoy the learning experience. But that doesn't mean that I don't enjoy the learning experience. But I do enjoy meeting new people as well, because you left high school, you left your university time. So then when you started going back into classes, for example, you never feel that joy anymore meeting new people. So I've been making new friends within the past 1 year. Even during the pandemic, we only met our colleagues like 3 or 4 times in a year, but then we really grow so close to each other that we really enjoy the experience of it. So trust me, joining MBA is not just about the learning experience, but also building your network, which is going to be really, really important in your career. Trust me.
Okay, thanks, Adam. Right, so one, the question: what makes the MBA more special than the other in the market besides its specializing in healthcare management?
Dr. Vijay, can I answer both questions? There's also a specific one.
Sure.
What is your opinion on MBA in Malaysia versus the States?
Yeah.
All right. Well, I came from a program that was offered in the States, and that was the same philosophy I brought back when I came to IMU. What was different in the state that I experienced is the friendliness of the faculty. In fact, there is no differences between us. There's no gap. In the US, they call their lecturers by name. They don't have, sir or mister, they just call their lecturers by name. They are just colleagues. So I think that's the same thing that we brought in. And then there was a lot of experiential learning in the US. And that's the same thing that we brought into the program. So if of course, in terms of standard, I wouldn't want to say that ours is lower than them, right? Because I've been there and I am making that comparison. But in terms of the micro learning, there may be much more, of course, in the States. So if you have you do have the budget to have an experience in the state, please do so, because seeing another country, seeing what they offer is definitely very, very enriching. But if you don't, yes, I think in Malaysia, I think we have suffice program, and there's always quality control in all the programs, to meet those standards. So the other question was, where was it? Vijay, what was it again? The second question?
The second question was, what make MBA more special than the other in the market?
You mean MBHM is more special than in the market?
Yep.
We are the first. I would like to say that IMU is among the first to get, because while we were doing, we can see our competitors also coming into the same market and trying to offer the program. But I think we are lucky in the sense that we've got the accreditation, the provisional accreditation among the earliest. So we would like to say that our MBA is MBA in Healthcare Management. In most schools, what they have is MBA bracket Healthcare Management, because it's just another concentration. Unlike ours, from the beginning, from the first course, from the first module, you're introduced, the healthcare subject is already included. So if we've talked about strategic management, then, well, first we probably do a very generic strategic management principles. We'll give you a few examples of the other industry, but definitely we'll also will not forget to focus on healthcare industry. And I hope that do answer the question, Dr. Vijay.
Yeah, thank you, Dr. Dr. I think you need to answer the third one as well. Are there any graduates from the program, and where are they now?
Yes, we're happy to say, we are very happy to say that we've got seven. We've got 7 graduates since the cohort 119. Where are they now? They are where they came from, but many of them actually have taken up a higher position. One is in Dr. Vijay, I think you remember the one is in KPJ Hospital, one is in Nilai Medical Center, one is in the CGIL. In fact, and I think many more, right? And Ampang Hospital. So they and some of them had the opportunity, because of their engagement within the program, their head of department saw their earnest interest in management, and some of them already are taken on a higher position before they join the program.
Yep.
Dr. Vijay?
Yep, correct. All right, and I think the last question here, an important element in MBA courses is the practical components such as action learning and industry engagement, which can be tough during the pandemic. What are the opportunities provided by IMU to bridge this gap? Okay, I think this is better to be answered by the student, but I give a glimpse on this, yeah. We are, as I told you earlier, we have this called as the guest lecturers, as well as the industrial leaders who come into the classes and give their feedbacks. Even though we are in the pandemic era, we still continue that, which we have online classes where the guest lecture will be online. Still, we are providing all this. The only thing is stuck here is the industrial visit. But hopefully that can be sorted out soon, and we can go back to the industrial visit and gain more experience or experiential learning from the management side itself. Apart from that, I'd like to listen from the Jonathan, Nandini, and Isabel on this question, please. Jonathan, any answer for this or anything add on for this?
Okay, okay, so as we all know, the COVID-19 pandemic has kind of like impacted our our way of having classes is, I've heard from previous batches that they have had all sorts of interesting industry visits and such, which I unfortunately was not part of. However, IMU has engaged very interesting speakers. In fact, I think one of the more recent ones would be the where we had a talk on how a field hospital was set up. So and it was very interesting, and the speaker gave a lot of really shared his experience setting up field hospitals in disaster areas. So but I think perhaps Adam and Nandini would be able to speak more about this, because they were around before the whole pandemic hit.
Yeah, Nandini.
Okay, hello. Okay, let me just turn on my video. Okay, yeah. So Jonathan and Dr. Vijay are both correct. We had industry experts come in and we had them as guest lecturers. And so they did a very good job explaining to us and telling us and showing us what they did and all that. But also what happened in some of the classes was that we had simulation, in that we would simulate certain situations in a workplace and organizations, and we would do those kind of learning, and we would brainstorm how to approach these situations. But also I would like to add that my cohort did do field trips. We did two. We went to Gleneagles in KL and we went to CPRC Putrajaya. So those two are very good experiences, especially CPRC, because we went there in the thick of the pandemic. So we got to see what they did and how they did it. We saw the screens and the room where they discussed and had their meetings. And it was very interesting. So these field trips, we did do them. It's just that Jonathan's batch have not had the opportunity to do it yet. So, but yes, the experts that came in as guest lecturers, they do a fantastic job of telling you how it is in the industry, and so you get like first-hand opinions and like basically just the truth from them. They tell you what it's like. So that was very helpful for us.
The other thing I would like to add on is that our research project, even though it's in the healthcare field, it always has got a business component to it. So so this is also one of the ways that that this gap is bridged. Yeah.
Okay, thank you. We are past 8:45. It's going to be 9. Okay, so thank you for all the listeners. Thank you all the participants who are here, and thank you very much to the speakers here, Dr. Jonathan, Dr. Nandini, Dr. Adam, and Tok Wan. Thank you very much. See you guys soon. If you have any doubts, please contact us in any way you can. Yeah, I think you can talk to the IME administration, and also you can come back to us. All right. Thank you very much. Have a good rest and good night. Thank you.
Right. Thank you, Dr. Vijay.
Thank you for having us.
Bye. See you.